I just wanted to start off by saying that 3 years ago my grandmother died 5 days shy of 100 years old because she had the best health care in the world. And 2 weeks later I came down with the rare variation of Guillain-Barré that if I had been in France I would have died because it was so rare. They spent enormous resources on me here in the United States at St. John's Hospital. To the gentleman who's visited France, apparently he's not aware of the incident several years ago where thousands of people died in the month of August during the heat wave because the doctors were on vacation. I'm sure that there were complaints about that. So I've said my piece. Thank you.
My name is Kathy Kleckner. I'm a resident of Highland Park, and I'm here, Representative McCollum, to urge you as strongly as I can to have the courage and the foresight to support a single-payer healthcare system in this country. The critique you had of the current problems we have, I totally agree with. The thing is, the only real solution is a single-payer healthcare system. The current idea of having a public option alongside all the private health insurance companies is a big mistake. It leaves in all the waste and creates like a two-tier system where the sickest people, the poorest people will be dumped into. We won't be happy.
I'd like to know how we're going to pay for this program with oncoming debts like that. You said before that somebody files for bankruptcy every 30 seconds due to a medical problem. If we bring this on ourselves, the whole damn country is going to be bankrupt. It's not going to be one person every 30 seconds. It's going to be the entire country going up at that point. Another point I'd like to make, I don't trust, in all respect, I don't trust you. I don't trust Republicans. I don't trust Democrats. I don't trust conservatives, liberals, or politicians with my health care. I trust two people. That's me and my doctor. Stay the hell out of that relationship.
Hello, I'm Jenna Rasmussen. I live here in St. Paul, and I work in the Minnesota's thriving medical device industry. And I'm actually a personal supporter of single payer. And with the companies I worked for, we do 40 to 60% of our revenue outside the United States. These are for-profit, Fortune 500, very successful companies who are profitable by selling to countries that have single-payer health insurance. Not health insurance, health care. They have excellent care all around the world, and we do good business selling to them at costs that are reasonable, but in places like Japan, which has universal health care, the top market, and they provide health care for $3,000 per person per year, where in the United States it's $7,000. So that's from the business perspective. Also, universal health care helps American businesses. No other country, if the car is made in Japan, Toyota doesn't provide that health care to their employees and spread across the whole country. The United States automakers are being bankrupt largely because they're forced to provide that health care. So universal health care is pro-business. And I'd also like to offer, if we're going to do that by way of the public option, I think that's a decent place to start. But perhaps stop using the phrase, keep insurance companies honest. Insurance companies are businesses. They're providing insurance. Insurance is risk management. That's all about denying coverage. That's what their business model is. And as the previous person said, those companies are very profitable. That's not necessarily the right model, though, for our health insurance and our health coverage. People need coverage, not necessarily insurance. If you've just broken your leg and you're uninsured, no right-minded insurance company is going to pay for that orthopedic surgery. That person needs coverage. And that level of coverage is probably going to have to come from a public option and not be keeping insurance companies honest. Thank you.
Hi, Representative McCollum. Thank you for hosting this event. My name is Jim Boydella, and after retiring as a social worker, I've been privileged to be doing a lot of political organizing with the FL-CIO Retiree Council as well as AFSCME. And I'd like to ask you what you can do, and then also have you tell us maybe what we can do to help you fight against taxing employer-based benefit, healthcare benefits. If you tax employers, you're going to be punishing companies that are doing the right thing. You're also going to be giving an unfair advantage to companies that are not doing the right thing. If you tax the employees, you're actually betraying organized labor, which actually was a big part of what helped get Democrats to the dance. I can't tell you how many pieces of literature I handed out that attacked Senator Coleman and John McCain on the basis of these folks are going to be taxing your health care benefits. Also, you're going to be imposing a tax on the middle class. And I think a big part of our economic problem has been the inability of the middle class to buy stuff. And so bolstering the middle class is what we ought to be doing rather than adding another tax to the middle class. There have got to be other sources of money to pay for this health care reform. Drug company excessive profits, health insurance company excessive profits, high administrative costs of insurance companies as well as the system in general, employers who have the money to offer health care insurance but don't, more progressive taxes, etc. Thank you.
One of the ways that we could improve delivery of care is by making a single administrative process of filing claims. We have tons of office personnel just trying to deal with each insurance company and figuring out which hoop to jump through and are you covered and those sorts of issues. So even just making it a single administrative form, whether it's multiple companies or not, would be a helpful thing. Another thing that I think would be helpful is to allow practitioners to practice at the top of their license. And as a physical therapist, we do a lot of work in prevention, and if we can see people early on, we are a much lower provider of care and prevent progression of disease and illness oftentimes, and as well as help get referral into the system for those people that really should be in the medical system further. And the last thing I wanted to say is that when we're looking at cost savings, I don't believe that the providers, at least at my level and the people that I know, the providers are not the ones out making it rich off of healthcare. And we do need to recognize that a large part of our economy are healthcare workers, and they need to make a living as well. And we need to keep adequate payment for providers. Thank you.
When I look at issues like this, I want to look at the facts, and I want to think it's something that's financially sustainable and fiscally responsible. So I look at how am I paying for health care? I'm paying for health care through premiums, deductibles, co-pays, taxes. When I purchase things like a car, several $1,000s are going to pay for health care for the workers who make the car. What am I getting? I'm getting something where 30% of the cost is going toward administration. The number of healthcare administrators in the last 30 years has increased 30-fold. The healthcare industry paid $1.5 billion in lobbying in 1 year alone. The top 10 largest healthcare insurance companies, the CEOs have an average pay of $12 million. None of these last stated things are providing health care. We have so many administrators that are not directly providing health care. The cost of health care is increasing 6% a year. If we want to save money and actually provide health care, let's pay what we're paying or pay less. We have to decrease the administrative cost, which is currently 30%. The job of health care is to save money. The job of health care is to deny coverage. That's not going to... And we're paying job and healthcare insurance, is to deny healthcare, save money, and with the high administrative costs. So I think we need something less interference between the doctor-patient relationship from the healthcare industry, healthcare insurance industry, and a system where it is a fiscally responsible system, single-payer healthcare.
Hello, my name is Pierre Coburg. I'm a Spanish interpreter at Regent's Hospital. I can't say nearly as eloquently as most of the people who've already spoken why a single payer system makes sense at so many levels. However, I do want to say, why are we talking about this at an official level? And that's my question. I think this is a good idea. President Obama, before he became president, thought that single payer was a good idea. But somehow in our official debates, our official discussions, single payer has been excluded. I don't know, you haven't come out in support of 676 or a single payer system. I wish you would. I'd like you to. But short of that, I wish you'd support, and I wish our Congress would allow open debate on this in political spheres, because I feel like it's wonderful to hear all this support from all these people with all these good arguments and knowledge, but we're not hearing too much of that on the news, and we're not hearing too much of that from you folks. And that really disappoints me, and I think you're a leader. That's your job. Your job is to make the necessary feasible. Thank you.
My mom and her side of the family came from Soviet Russia, and she told me horror stories about what the healthcare system was like there. And I just like to remind everyone here to think about history. We don't just have to look at Soviet Russia. We can look at modern-day countries like Canada, France, other European countries that have nationalized healthcare. Another point I'd like to make is that you said that we have choice. We can choose between private-run health insurance or socialized medicine. But, okay, I'm sorry, I'll stick to government-run healthcare. Studies show that 120 million Americans would be switched to a government-run program by their employers, and they would not have any say in the matter. Why can't, if employers have this choice over their employees, why can't they have choice about unions or how much they pay their employees? I mean, the Constitution doesn't guarantee they have a right to a union or a right to a certain wage, and they don't have a right to health care in the Constitution either.
I lived in France for 3 years, from 1989 to 1992, so I got the benefit of experiencing socialized medicine. The French do have nationalized health care, but if your company will pay for some, my French neighbors would tell me when my son had to go into a small operation, you're better off going to a private clinic because the French system is broken. So I spent those 3 years, and I got to see what socialism was really like, and it's starting to look a lot like that here. But if you want to improve the healthcare system, competition is good. Open up my ability to buy the health care insurance that I want, rather than the state of Minnesota limiting to 4 companies. If you want an example of how competition and free market works, take a look at LASIK surgery. It came out at one time being about $3,000 an eye, and I think you can get it for about $400 an eye. It's better, it corrects astigmatism, it keeps getting better, the equipment gets better. That's an example of what the American system does and how competition makes things better. So what we need to do is get the government off the backs of our medical industry, get the lawyers out of their pockets, do something about tort reform, because that's a big reason why our cost is higher than France. They can't sue their government. So if they do something wrong to you, it's your tough luck. And my French colleagues, by the way, they took care of dental care too. And most of my French colleagues at the age of 30 didn't have any teeth. Because the government didn't pay for routine maintenance, they paid for extraction.